Thank you for coming out today. We are very excited to have you here. We are interested in creating a global research fund. The objective is to raise money and provide it directly to those doctors and researchers who can make the most expeditious and effective use of research funds in the name of finding a cure for visual snow. Then and only then can we move from the cure of understanding to the cure.
My visual snow baffled doctors. All the tests they ordered, from PET scans to every clockwork orange-like exam in the book, came back clear. In fact, in some areas, my health was exceptional, which begged the question, if everything is fine, then why am I seeing unceasing television static across my visual field? So my anger and frustration regarding the physicians who didn't help me transitioned to the idea that maybe, as a sufferer, I should try and help them understand my condition. It's imperative that visual snow syndrome garners the attention and legitimacy it deserves. We've been forced to bounce between ophthalmologists and neurologists to no avail, subjected to a conglomerate of intrusive exams that give us no relief or answers. Suppositions from some experts range from suspicion to outright denial that visual snow exists at all, let alone is a legitimate condition. We now know that is not the case. Many people are born with visual snow, while others can develop it at any time. Our voices are being heard more now than ever before, and people want to listen. Let everyone hear you and speak about what it's like living with visual snow. No matter how much you suffer, never lose hope and know that you're not alone. And I'm here to tell you what nobody else may have told you yet, which is that you're going to be okay. Not all days will be perfect, but you're stronger than your visual snow. It doesn't define you, so go out and enjoy your life. There's answers awaiting us, and we're working on it. So while I may not see clearly, I can certainly see there's a promising future ahead for all of us. Thank you, guys.
By coming together from so many different fields, people with Jim's background, people with Joanne's background, to be able to have this type of teamwork in trying to solve a problem is extremely important. It's one that's being recognized by funding agencies all over the world, really, but particularly NIH, that team science is really important. To be able to solve a medical problem, we've had hundreds of years in attempt of solving medical problems, and seemingly, especially as a patient, you probably feel like we haven't gotten very far. So what the thought is now is by working in teams with expertise that come from completely different backgrounds, such as Jim's, for instance, versus mine, totally different backgrounds, but to hear him talk about his thoughts and understanding based on his background is very different than hearing somebody from my background and we all working together who are just neuro-ophthalmologists. So bringing these teams together are really going to be a way to solve this as well as other major medical problems.
For the students and others that have their PCs with them, you can go to my website and follow along, because some of these are going to have more detail in them than you really want. I'm not going to go through it. It's mostly a matter of trying to convince you that I've been working pretty hard on this problem.
Basically, knowledge is power. And isn't this what this conference is all about? It's basically knowledge. So Kofi Annan said something which really struck me. Knowledge is power. Information is liberating. Education is the premise of progress in every society, in every family. And this is really about society and about family. So I think that this is a huge first step towards really capturing the essence of visual snow and helping people who suffer from it.
Okay, I'm a research scientist. I'm not a clinician. And my research training is actually in psychology. Now, I didn't put that on the website because I'm acutely aware that a large number of you in the audience actually suffer from visual snow. And I'm also aware that the term psychology means something very different to different people. And I desperately wanted to avoid raising the spectre of visual snow appearing as a psychological condition. It's incredibly clear that visual snow is not all in the mind. It's very much a neurological condition.
The reality is that most of you here, or many of you here, have what for some is an affliction, for some is discomfort, for what is a problem. You are not alone. I have an affliction. I suffer from being a doctor. Okay? And you may think that's funny, but the reality is, as you heard today, you have a cognitive disorder. I have an acquired cognitive disorder. I have taught to be rigid in my thought processes, to not go beyond, to not think of advances or new things, or to consider anything that's difficult. And we'll approach that.
And I think one of the things which got me really interested in it was that children describe it exactly the same as adults. And children have a wonderful frankness about them. They've got all sorts of explanations for what's going on, but they do have a wonderful frankness. And it's hard to walk away from a syndrome that, as also one of the speakers said, is just the same everywhere. Everywhere you go, if you ask about it and listen to what a person says, they more or less say the same thing, with some twists, of course. They say a core thing. And I think that's why our colleagues interested in physiology and anatomy are attracted a little bit to this, because it's clear, there's clearly a pathway thing going on in the brain. There reaches a point when you see things where you either do something about it or you just shut up. And it struck me some time ago that it was time to do something about it, because it's just nonsense to keep hearing the descriptions and not having anything satisfactory to say. So just irritating.
I've been to 40 different countries over the last 10 years, taught medicine and surgery all over the world, operated everywhere, and met a lot of people. But this article and Visual Snow actually exposed me to the rest of the world like no one has, and or nothing has, I should say. And I've had emails from Norway, Finland, from Vietnam, even from Egypt, about people who suffer from visual snow. Now, a message to my colleagues, coming back to why I'm talking to. So what do doctors know? Well, you know, not a lot, unfortunately. And that's why this is a team effort. We need you guys. We need to work together to come to, to discover solutions and what to do with this.
We might be starting to get an inkling or some sort of understanding of what might be driving visual snow in the first place. And collectively, the proposal is that of heightened neuronal sensitivity or cortical hyperexcitability, which you may have seen certainly in the literature. And certainly within the visual system, although there is various opinion about whereabouts in the visual system that may be, but obviously not necessarily just in the visual system if you think about the associated symptoms, including tinnitus, paresthesias, tremors, etc. But certainly understanding what these changes are is a necessary and important first step in treating visual snow. And also what's important also is that not only are we helping to provide insight into what's driving visual snow in the first place, but we're providing very sensitive means to monitor change. And the reason that's important is because once we determine what's driving visual snow, we start creating effective treatments. We need to be able to measure the effectiveness of those treatments, and we can do so without simply relying on people like yourselves to say, yes, that's a little bit better, no, that's a little bit worse. We can actually measure these with a great deal of precision.
Now, I'm also going to discuss the fact that neurology cannot be approached without understanding ophthalmology or vision. And let me point out that vision is not ophthalmology. Ophthalmology, with all due respect to my ophthalmic colleagues, by the way, I'm a neuro-ophthalmologist, but have a fair training in ophthalmology, and I have acquired the contempt that all subspecialties have for all other subspecialties. But it is not too much to say that without an extensive knowledge of ophthalmology, a methodological investigation of diseases of the nervous system is not merely difficult, but impossible. Now, to extend that thought, you have to understand that 48% of all nerve cells that enter and leave the nervous system, that's including the cranial nerves and all those nerves that enter and leave the spinal cord, 48% of them are related to vision and control of eye movements. Leaves with the impression this might be a fairly dominant system in our existence. Let's go back to a little bit of personal experience in modern neurology. I had a classical training. Many of my colleagues of my age had classical training. The people who are being trained today are getting the same training. A bit of a worry, actually. But largely we were taught not to question, while at the same time we were taught question everything, okay? But the minute you questioned it, people were not impressed with your attitude. That was a bad attitude. Ignorance was bliss and remains bliss. Unfortunately, patients are disruptive. They get in the way of a good life. They keep telling you things that you haven't thought about and that you don't want to think about and you're not going to think about, and you just want them to leave the room so that you can get back to treating simple things. They're a serious impediment to happiness. But let's just think for a minute. You've got 100 million photoreceptors in each eye, okay? And in the occipital cortex, you've got 140 million receptors on each side. But you've only got 1 million cells in each optic nerve connecting those two areas from the front to the back. So what does that mean? It means you're not seeing me now. Or you may wish you're not seeing me now. But the reality is you are not seeing me now. You saw me a few minutes ago, a few seconds ago, and you remembered me. And all you're doing at the moment with your optic nerve is updating that system. Okay? So your vision, your perception of the world is in fact a perception within the brain. It's not actually stream of consciousness.
And what we found was that a particular area, the lingual cortex, already been mentioned, is more metabolic, more active in people with visual snow than controls. And it's just hard to argue that that's not a thing, because that is a thing. What it means, what the implication is, whether that's actually the important area or that's a consequence of something else, that's an open question. But there's the fact that there is a thing is the thing. And that's been helpful for getting many of my colleagues to buy into the idea that there probably is a thing. These are the sort of, many of you will be familiar with these, of course, because we will have them, the classification of the kinds of disturbances that we see, the coloured, black and whites, the flashing static, and then the transparent static. And people have anything between one and all types of these. Most patients will only have one. Why are we doing this sort of, why do this kind of thing? Because if you want acceptance in a condition, you have to provide very detailed phenotyping information for physicians. And they won't remember it all, but they'll remember, my mission is to make and remember there's a thing. And a lot's known about the thing, so all they have to remember is the name, and they'll start to make the associations. It's very important in physicians' minds.
Now, the previous survey I took was a small group from a statistical point of view, and so these numbers are very rough, and I hope to do a better job on this 2018 survey. But about 3% of the people that responded had a genetic, they had the symptoms at birth. Now, there's no known way to evaluate having visual snow at birth, but reasonably around the age of 5 or 6 or 7, the child is talking to its mother, and the mother is saying, "Do you see the shiny car outside the window, or the solid wall painted dark shiny blue?" And the child says, "Well, I don't see anything shiny about it. I see almost a furry like this sweater," you know. And that's when it first surfaces as visual snow to most genetically inclined people. Roughly 30% showed up to have an age of 18 to 30 years, and about 30% had been using recreational drugs. Frequently the problem comes on after some sort of drug, whether it's prescribed or recreational, about 2 to 3 weeks after the drugs are absorbed. We also saw a strong tendency among roughly 10% of the people that that found the visual snow very distracting to the point that some of them actually pulled out of college because they couldn't read well enough, and it was just too much of a workload to try and live with that. This area that I'm going to sketch right here with just my finger is an area that does not appear in any textbooks. For some reason, the textbook people and the academics of the last century, the 1900s, didn't recognize that there's a piece of the thalamus that's at least as important as the visual, quote, primary visual cortex. I try and leave the primary off because it's not primary in my estimation. It's important, and it's numbers 1 through 4, but the 1 and the 5 is through this lower pathway that I showed earlier that has nothing to do with the rear of the brain. And you'll see a lot of doctors in that talk about where your visual cortex is, back of the brain. But the real high resolution part of your field of view, that little circle that I drew earlier, is not at the back of the brain, it's in the center of the brain. And that's very hard to get to. But watch for a change in textbooks in the next 5 years.
So what Jim was talking about is that we can't find this problem for visual snow being within the eyeball itself or even in some of the earlier areas. It has to be where parts of the brain are responsible for understanding what's happening throughout the visual field, not just in one half of the visual field. And so what do we know from everything so far and what I just presented to you is that visual snow is really beyond the eyes and involves higher order visual regions of the brain, not just the visual cortex, but likely the thalamus as well. So visual snow syndrome as a cortical hyperexcitability syndrome does have some evidence, again by Dr. Goldsby, where they saw an area of excessive metabolic activity in people with visual snow while they were essentially at rest. And this higher order visual region is within the temporal lobes in an area called the lingual gyrus. And this area is extremely important for processing visual information. And so it doesn't seem to be any accident that we're finding hypermetabolic changes or potentially hyperexcitability in this area of the brain in people with visual snow.
So for me, healthy lifestyle changes and mindfulness practices like yoga and meditation were tremendously helpful to me for turning a chronic bothersome set of symptoms into manageable symptoms. So what it looks like is that the people that are bothered by their symptoms have essentially wired this negative response to the symptoms in their brains. So the negative thoughts, the negative emotions, the stress, anxiety, depression get wired up with the experience of the symptoms. So the symptoms essentially are causing this negative response in the person, and that negative response then is causing the person to focus more on the symptoms and potentially even aggravate the symptoms as well. The stress just makes the symptoms worse. Now, this can create a feedback loop that can eventually grow out of control, which then leads to kind of the downward spiral of the individual. However, if we can break this connection between the negative response and the symptoms, we can essentially reduce the overall negativity or reduce essentially the effect of this. And so it appears that certain practices, mindfulness practices like yoga and meditation, in addition to certain psychological practices like cognitive behavioral therapy and mindfulness-based stress reduction, appear to actually help break this connection and reduce that negative response to the symptoms. And now I want to point out that this is much easier said than done. I'm standing up here talking as this, oh yeah, anyone can do this. But I do need to point out that where I was a couple years ago to where I am today was not an easy path to walk. This actually took quite a bit of time, a bit of effort, and it was just a difficult journey all in all. So for those of you who are still struggling to manage your bothersome symptoms, I have a few words of advice. Number one, there is hope. We have people researching this visual snow syndrome, tinnitus, around the world, and things are moving forward in terms of research. We have organizations popping up, like the Visual Snow Initiative, that are essentially helping spread awareness and helping raise funds to get the research done that needs to be done. Number two, don't give up. In the meantime, we have things that we can do in order to help manage our symptoms while the experts are essentially working on developing treatment protocols. So there are more people, not just me, there are people out there that have used mindfulness, healthy lifestyle changes, yoga, meditation, in order to help manage their symptoms. And third, try to change your relationship with your symptoms if possible. And I know this is, once again, easier said than done. If you can reframe this experience as a positive thing, an opportunity to improve your life, to help others, to essentially make the world a better place, that makes a huge difference.
You all know the associations. The causation is uncertain, and there's probably more than one cause, okay? If we're talking about a network, if something goes wrong anywhere in the network, the whole network is dysfunctional. You don't know necessarily which part of the network that is. The investigations that we do these days are listed there as MRI, EEG, visual electrophysiology, OCT, visual fields, neuropsychological evaluation. I love them. We make money out of them. You know, fabulous stuff. The fact is that it really doesn't do very much clinically, but these things probably need to be done in the experimental situation to rule out that we're dealing with other systems. Okay? But whether they should be done in the clinical situation where patients are not participating in research projects is dubious. So the future? Well, better understanding certainly helps all of us. Quantification of the disorder will help. Trials of therapy will help. So in reality, there is a bright future, but the future is an uncertain amount of time. The reality is that the accumulation of knowledge is expanding exponentially, and I don't know how long it will take to have a better understanding of this. I don't know how long it will take to develop effective therapies for a significant number of people, but I'm optimistic.
So I come to the following conclusions, and I show you another little picture down there. Little fella asked to draw, I think it was his aunt, and draws his aunt. Not quite as elegant as the last one, but pretty cool. And then all those little dots. Where did he get that from? Where does a 5-year-old get that from? Except they got a genuine problem. They don't make that up. This condition clearly exists. Clearly exists. I don't think patients describing they're just not crazy at all. We're all a little crazy. It is what it is. But it's not the basis of the problem. It's not a type of migraine. There's nothing that points to that. The phenotype doesn't point to it. The physiology doesn't point to it. It doesn't behave like that. It may coexist with it, but doesn't behave like that. And it's not simply due to illicit drugs. So I didn't say to you, but we've excluded people, with all due apologies to them, who've used illicit drugs in our studies. Why? To answer this very question, because if we'd included them, we'd only been pilloried for doing it. And it's not to show any judgment about it, but simply to try and get rid of some of the nonsense around it. You have to do that. It's a real problem. It's a problem that's predominantly in the brain. I illustrate the area there again because it's been helpful for the work. I think that going forward, this initiative that is really kicking off today, if not for someone picking the ball up and running with it, nothing will happen. But there's such an opportunity. I'm a little more optimistic maybe than many, because I've seen this go from nothing to a thing in a very short time. And this condition's of its age. It's ready, and the technologies are available to dig into it and understand it. There's such an opportunity. I have to say, on behalf of neurology, let me apologise to you if we as a group have ignored the problem. And let me assure you, however, that there's an optimistic tone in this, that things will get better, not because we're just sitting around talking about it, but because we're doing things, and with all your assistance, one day we'll get there. Thanks very much.